Hey guys, today I'm going to be going over Portia's surgery. As you guys know, Portia is my Lynx Point Siamese cat, and he recently had some issues going on with his ear and had to have surgery twice. So here's how he looks now. You can tell the ear is smaller. He didn't lose any of his ear, but I'm going to be explaining what happened and the process that we went through and all of that. Now, I did film when he got his second surgery, so if you guys are grossed out by blood or you're squeamish, or if anything's going to be triggering for you, you might not want to watch the whole video. However, I will be saying when that's going to come on the screen so that you can look away or cover the screen or something. And then I'll let you know when it's over so that you can come back to the screen. So if you want to just listen to me talking about it and going over it, but you don't want to actually see the surgery, then just, keep an ear out for that, because I'll let you know when it's going to come on the screen. I'm going to be trying my best to describe everything to you guys and let you know what kind of products we used and all of that. And some of it's hard to pronounce, but obviously I'm not a vet. Now, Portia is getting kind of heavy because he decided that he's just going to flop over and sleep, so I'm going to let him go back to bed, and I'm going to tell you guys about what happened. Okay, so Portia got an Aural Hematoma, and you can see from this picture here that his ear swelled up like a balloon. So basically, there's the two ear flaps, the outside of the ear and then, the inside of the ear, and there's a lot of blood vessels running all through the inside of the ear. So in this case, a blood vessel ruptured, and that's inside of these two, pieces of skin, and the ear started filling up with blood. So it just started, filling up and swelling, and that's why it looks like a balloon, because these two pieces of skin start separating, and all of that's just full of blood inside. Pretty gross, right? Now, this can be caused by the cat scratching too hard at its ear, shaking its head too much. I'm assuming he was scratching his ear and just scratched it too hard. I didn't see it happen. I found him later during the day like that. I saw that this had happened to him in the late evening on February 7th. And then by February 8th, the very next day, we had him in surgery. Now, I didn't film the first surgery or take pictures. I guess I was just too stressed out from what was going on to think about it. But basically what happened was the veterinarian drained all of the blood out of the ear and also made a cut. So if you're, looking straight at the cat, there's the inside of the ear. He did a cut right through the middle part of the ear. And that's for the purpose of the blood vessel being able to drain all of that blood out of the ear until it actually closes. And then around the ear, he did a lot of stitches to put those two pieces of skin back together. So they were put back together with a bunch of stitches all around the ear, and then the cut in the middle. And the stitches, it all looked kind of Frankensteinish. I did not get a picture of Portia like this, but this is a picture here of a dog, and this happens to cats and dogs. So this is basically what it looked like after the first surgery. Now, I did post a picture on Instagram of Portia when he did have all the stitches on his ear, and it was from a kind of weird angle. And this picture, it looks like he's actually missing part of his ear. Again, he doesn't have any of his ear missing. All of it is still there. Now, normally what you can expect from this, because, it is pretty common, it might have even happened to one of your cats. I know somebody on Instagram said that they went through something similar. So basically, you would expect for that cut, the incision, to just, be draining blood until the blood vessel closes. The blood vessel would close by itself, and then you would take the stitches out after a couple of days. But the point of the stitches is just to keep the ear flaps together, and then the incision just lets the blood drain out so that it doesn't create that balloon pocket. Now, what actually happened in our case was that the ear kept bleeding a lot. It was actually pretty frustrating because Portia would shake his head and then droplets of blood would go everywhere, and I was constantly going around the house cleaning up little splatters of blood all of the time. It was kind of gross and inconvenient, but I just, really was hoping that it was going to stop eventually and his ear was going to go back to normal, but that's not what happened. So we waited as long as we could to remove the stitches around the ear. When we did remove them, the actual incision right here had already healed. Now, you could still see it, of course, but it had closed. That's what I mean by healed. It definitely was still there. And when we removed all of the stitches, the ear just flopped over, which I was a little bit disappointed about. I wanted the ear to go back to normal as much as possible, and also, a flopped over ear just leaves them prone to ear infections and makes it more difficult to keep clean and all of that. So it flopped over, and then the next day it had gotten swollen again, basically just, blew up as like a little balloon all over again. So that meant that the blood vessel had not healed, that it was still actively bleeding, and basically that we're going to have to go through the whole thing over again. So we're back to the same problem, and our veterinarian was surprised because it is something he does on a routine basis. It's a routine procedure. It's very common, like I said, with dogs and cats, and he was surprised because usually it works the first time and that's it. But it didn't work, and I didn't want to have to go through the same thing all over again when that wasn't working for us. So what we did different this time is we actually used a method that's for human wounds and not really used on animals so much. So on February 25th, I took Portia back in for his second surgery, and all of this is going to be coming up on the screen. I did film this part, so if you're a little squeamish with blood or you just don't want to see something so graphic, this is time for you to look away from the screen, and I will let you know when that part is over. At this time, Portia is under anesthesia, so he is sleeping and cannot feel anything. He won't remember any of this. The wound in the middle of the ear is from the first surgery, and that will be cut open again so that we can drain out all of the blood that is building up inside of the ear. The blood has clotted inside of the ear, so that needs to be forced out. Now the rest of the blood will be able to come out. We are flushing the ear with saline to make sure that we get it as clean as possible. And here we are swabbing the ear with iodine. This kills bacteria. This is one of the diluted forms of iodine and safe to use on open wounds, but this is only used once on the day of surgery and not used again during treatment. And now checking the cavity to make sure that there is nothing left inside of the ear and that all the blood clots have been removed. This also removes the iodine to make sure that nothing is left to irritate the skin. And here we're using a collagen-based dressing that contains silver and measuring it to cut the right size because this is going to go inside of the wound in the ear. This is to help the ear rebuild collagen and heal faster. It increases the rate that the connective tissue will heal. This is what made Portia's ear stand back up after the second surgery. The silver is used to kill off bacteria. And we're putting one on either side of the incision, and this has forced the ear in an upright position. The body will be able to absorb this collagen. Some dressings that go into the wound do need to be removed, but this is not one of them. This one can actually be absorbed. Now we're using calcium alginate dressing. Part of this will stick out of the incision and keep the wound from closing. We want to make sure that the incision is kept open until the blood vessel heals on its own, and then the ear will not swell up like a balloon anymore. This is made out of algae and silver and also prevents bacteria from growing. Now we're going to put an oil gauze over the wound. And this is so that the wound does not stick to the dressings and so that when we remove the dressings, the healed tissue does not get pulled off. And we're sticking a sponge to the ear. This will absorb the drainage coming from the wound. And this will provide support so that the ear will stay in an upright position and be in an upright position once healed. And now wrapping the ear in gauze to protect all of the dressings. And from here we will wrap the ear and head to keep everything on the ear and tape the dressings at the end. When seeing the wound care done for the first time, I was concerned about how we would manage to do it when Portia was conscious. We would have to do the wound care treatment daily, packing the ear and cleaning it. And much to my surprise, Portia did so well with tolerating it. He would grab onto our leg like he was hugging us and just stay very still while we did his wound care. And this included packing the ear. I was very impressed with how well he did. It was better than what I could hope for. Okay, you can look back at the screen now because all of that is over. There's not going to be any more blood or anything like that in the video. Since we wrapped Portia's head for this healing process, I did have to put a cone on him so that he would leave the bandage alone and not try to take it off. He even tried to take it off, shaking his head, and we had to adjust the way that we wrapped it in order to really make sure that it stayed on the right way. Now, this was difficult because he did still have use of the ear, so the way that cats can move their ears forward and back and all of that was difficult to make sure that the dressing was able to still stay on with him being able to move his ear and shaking his head because he did get it off and we just had to, readjust it and get it back on. So the first day, it was kind of just figuring out how to make sure that we kept him comfortable but also kept it on. And then after that, we kind of got a little routine and process going for the wrapping, and we're able to do it really well. And from there, we did wound care on it every day, where we would take all of the dressings off, take the packing out of the ear, and then clean up everything, put in new packing, and then just, wrap the ear again. Right away, I saw that the ear was starting to stand up again. We were rebuilding that cartilage, and it was actually starting to heal a lot better. Now, from the first surgery, his ear did shrink a lot, and that's why on Instagram, some people thought that the ear had actually been cut, or that there was something missing because it was smaller, but it had just been shrinking. And then so after the second surgery, with this method that we were using, the cartilage started coming back and getting stronger, and some of that shrinking actually was able to be reversed. And Portia was actually really loving the attention, let me tell you. He was such a big baby. He wanted to be cuddled, and I started realizing that it wasn't even from being in pain, or it was just, he actually really enjoyed the attention. Now, we did have him on painkillers, and we did have him on antibiotics during, the whole process during both surgeries. So about 2 weeks after the second surgery, we were able to take all of the bandages off and even remove the cone, and everything had healed up pretty nicely, as well as, the incision from the second surgery. The incision from the second surgery, I think, was a little bit bigger than the incision from the first surgery. The ear started standing up straight. He does have a little bit of the cauliflower ear, and the ear is smaller than his other ear. This is because his ear was shaved, so he doesn't have as much hair on that ear. It's, starting to grow back now. And the ear is also just a little, it shrunk a little bit from everything that, went on. But overall, the ear did heal really well, and I think it's as much as we can expect from this situation. He's doing great. It doesn't bother him. It's standing up. So at the end of the day, it all really worked out. Thanks for watching this video, and if you found it interesting, be sure to give it a thumbs up. And if you're new here, be sure to subscribe. I put out educational videos about animals every week. And if you want to keep up to date with my pets, be sure to follow me on Facebook, Instagram, and Twitter. Thanks for joining us. Bye!